Diversity training and conflict management programs are implemented in all different types of businesses and corporations, from small to worldwide. The reason these programs are put into place is so that their employees can communicate effectively with each other as well as with their customers. The need for these types of programs in medical facilities is great, due to the many different types of people that work at and/or use the services of hospitals, doctors' offices, ambulances, etc. The following statistics regarding healthcare employment in the U.S. are based on occupational classifications established by the U.S. Bureau of Labor Statistics and include medical and health services managers, healthcare practitioners, and technical occupations, as well as healthcare support occupations. As of 2009, there were 11,414,440 people in the United States employed in healthcare. When I began the foundation of this project, I asked myself a research question. What diversity training is available for medical professionals in the workplace, and how beneficial is it in the medical facility between employees and with patients? If necessary, how can these services be improved or geared more towards our community? I will now go on to present my thesis and argue why the St. Joseph Regional Medical Center needs to make a drastic change. St. Joseph Regional Medical Center says that they are doing one thing for their program, but they are doing something completely different than what they are saying they practice. We see this currently because there is no administrator in position for diversity and conflict management at St. Joe Regional Medical Center. During my interview with Dave Goldman, instructor recruiter for St. Joe, he stated that currently we have all St. Joe Med employees go through a new employee orientation class that includes a PowerPoint on diversity training and conflict management. There is also a course on HealthStream for employees to take through their iLearn accounts for further diversity education, but similar information. Following our phone interview, Dave informed me by email that the PowerPoint presentation he used to use for their training program is no longer used, and that the only thing available is the iLearn module on HealthStream. There is no plan, system, or survey used currently to see if the minimal training provided is beneficial or not. Dave also stated during the phone interview, "I'm not sure that we go that deep into diversity training, other than how to get along with people of different races." Martin and Nakamaya define in our text diversity training as the training meant to facilitate intercultural communication among various gender, ethnic, and racial groups in the United States. Yes. The PowerPoint presentation that was used for the new employee orientation is no longer being used at all. When starting to analyze this PowerPoint and the information included, I chose to compare it to a PowerPoint on diversity and inclusion from the U.S. Department of Veterans Affairs. I chose this organization because finding information for other hospitals' programs was a little bit more difficult, and this program was easily found and very applicable. As we can see, other organizations, such as the U.S. Department of Veterans Affairs, take programs for diversity training and conflict management much more seriously than St. Joseph Regional Medical Center, and the evidence is in the textual analysis comparison. I've seen how the lack of information and proper training has affected St. Joseph Regional Medical Center and its employee communication. I have seen firsthand how the St. Joseph Regional Medical Center's program is not working effectively and needs improvements. After going to the new employee orientation at St. Joe, I did not find any information provided beneficial for diversity training or conflict management. I do not feel like I received cross-cultural training as it is defined by Martin and Nakamaya in our text. Cross-cultural training is defined as training people to become familiar with other cultural norms and to improve their interactions with people of different domestic and international cultures. After working with others in my facility, I have found that several others, people in power in particular, make very little to no attempt to respect other diversities different from their own. St. Joe needs better leadership management personnel who will make these changes happen, not just in writing, but actually put to use in our facilities. A better diversity training program would not only benefit the employees and their relations, but also St. Joseph Regional Medical Center as a business and an aid to the community as a whole. Our text emphasizes power in intercultural interactions on page 139. It points out that, regardless of whether we choose to recognize the foundations for many of our differences, these inequalities influence how we think about others and how we interact with them. It continues to say, the more you know, the better you will be positioned to engage in successful intercultural interactions. I had a very difficult time finding information for diversity training and conflict management resources other than through the hospital translator. Francesca, the head of the interpretation department at St. Joe Regional Medical Center, stated during a phone interview that, "I don't know of any diversity training or conflict management skills that have been implemented since I've been here." My final thoughts on this project are the resources that were available for diversity training and conflict management are not beneficial. St. Joseph Regional Medical Center says that they are doing one thing for their program, but they are doing something completely different than what they are saying they practice. We see this through the interviews with Dave and Francesca and how they are stating what they have done in the past and examine what they are really doing now in the present and how this does not satisfy the specifications by our text. When comparing St. Joe's program training material to another's, I found that they were extremely lacking in pretty much all areas. This is obvious after viewing the U.S. Department of Veteran Affairs PowerPoint presentation versus the St. Joe Regional Medical Center PowerPoint presentation. I have seen firsthand how St. Joseph Regional Medical Center's program is not working effectively and needs immediate improvements. I feel as if I have nowhere to look for guidance, resources, or support on how to better prepare myself for possible cultural differences. St. Joseph Regional Medical Center should hire someone to put into position of power with previous work experience and a successful diversity and conflict management training program. They need to reevaluate their current training methods and implement these new methods immediately. They need to use programs that are already currently in place and are being successfully used to model a new program. One example of things that could be implemented into the new program is from our text on page 455 through 456. It states, "There are no easy answers in dealing with intercultural conflict. Sometimes we can apply the principles of dialects. Other times we may need to step back and show self-restraint. Occasionally, though, it may be more appropriate to assert ourselves and not be afraid of strong emotion." We can also see this in the 7 suggestions for dealing with conflict. Guidelines like these will help St. Joseph Regional Medical Center better prepare their employees for possible everyday conflict in any situation.